Hello, I'm Dr. April Lynch from Bluegrass Veterinary Hospital, and today I want to discuss with you how to know when it's time to say goodbye to your beloved pet.
How can I help you to say goodbye?
This is a delicate topic, and it's called euthanasia, is the medical term that we use to indicate an intentional ending of life for your pet as decided by you and your caregiver. The word euthanasia, it comes from a Greek word which literally translates as the good death or the kind death. What that means is that as veterinarians, we have a unique opportunity to end suffering by our choice, in our timing, to allow your pet to die with dignity, without pain, and without it being a drawn-out process, which is not always true for humans. In human medicine, euthanasia is not an option. So as you probably know, it is something that is a very delicate topic, end-of-life care, and oftentimes human patients don't get to die with dignity or by their own choice, and it can be a painful and long process. If you've ever witnessed someone that you care about going through the process of dying, it can be a very traumatic experience for everyone around. I've certainly watched someone that I cared very much about pass away, and I wish I hadn't had to go through that experience. However, as you know, it's important to be there in those moments. Oftentimes, it's just a very hard thing to witness and to see, because it is not a quick process in most cases, which is an unexpected thing. Death is not always quick, painless. It can be excruciating. It can be very traumatizing. Other terms that you might hear associated with this that are more like common colloquialisms would be put to sleep, put down, or terminal. So these are things that can be used interchangeably, sometimes to make it sound a little more acceptable. But it is oftentimes what most people think is the hardest part of my job, and I often have people say to me, I could never be a veterinarian because I could not deal with euthanasia. And I want to point out that it is extremely sad, and I am very empathetic to my owners. It's hard to watch them struggle with the decision and with the profound sadness and grief that follows in the loss of their pet. However, it is also a unique gift to be able to end suffering for my patients, and the timing and allowing their loved ones to be present and for them to experience a pain-free passage into death. I often say that death can be beautiful, but dying is ugly. So as a veterinarian, I can offer the gift of ending suffering and ending illness or decline or pain in a controlled fashion and in a very rapid, painless process at the discretion of the owner and myself. You are their advocate. They can't advocate for themselves. They can't even talk to us and tell us whether they've had enough, but we can do that for them as a team. You and your provider can make this decision for them, and honestly, there is so much relief and peace that follows in most situations that it is something that I see as a positive in my job and in my day-to-day. So what are the reasons that we might consider euthanasia? Just to cover all aspects, and so we can all think about these things together. We've talked about ending suffering, ending pain. So oftentimes it's associated with terminal conditions. So my pet has cancer, my pet has liver failure, my pet has a degenerative disease where they can no longer walk. Those are all very common scenarios that we see. Some other reasons, though, that we might not think about as commonly would be when something unexpected happens. Sadly, we do oftentimes euthanize young pets or otherwise healthy pets because they were hit by a car. And obviously that was unexpected. Their injuries are not compatible with life. Those would be reasons to euthanize in an unexpected situation. Or a bloat. If your dog happens to have a dilated stomach, and that's an emergency surgery. Many of those dogs don't do well, or their vital signs are very poor. They're not good candidates for surgery. These are situations where an owner has a healthy pet one day, and then later that evening or the next day, they're having to have hard conversations with their veterinarian about whether or not to even allow their pet to continue to be treated or to make the decision to put them to sleep. Also, a part of my job is offering a behavioral euthanasia. So sometimes, most commonly, it is related to aggression. So pets that have bitten owners, children, people, sometimes it could be mandated by law enforcement, and that's unfortunate. However, human safety is a priority, and oftentimes we are at the mercy of the court or things that have been mandated. There's also rabies considerations and laws involved there. And also working in an animal shelter, it's a sad fact to think about, but we have a significant pet overpopulation issue in the United States. And due to irresponsible breeding or unwanted pets or pets that aren't spayed and neutered, or just feral populations, especially with cats, there are just far too many pets and not enough homes. So shelters have to make decisions to euthanize healthy animals on a regular basis because there's not an owner for them and there's no one to take care of them. So how is this process administered? And that is really one of the most common questions that people have, because if you've never had a pet put to sleep before, there's a lot of wild ideas, or just your imagination can run wild. But let me assure you, it is a very simple, very controlled medical process. Basically, your veterinarian will administer a medication, which is basically an anesthetic, as if we were going to do surgery, but we are giving an overdosage of that medication. It's usually a barbiturate, and it's oftentimes a much higher dose than we would do if we were going to have surgery or a procedure done. And what happens is your animal becomes profoundly sedated, and then what follows is cardiac and respiratory arrest. It's a very short process. And I want to go into what to expect if and when you should come in for a scheduled euthanasia, what to expect so that you're prepared and that you can make the best decision for your pet. Here is a list of some of the common questions that I get before owners come in for this big day where we're going to euthanize or discuss end-of-life care. Is it painful? Is a very common question, and that's a great question. In general, no. Absolutely not. The animal does not feel pain. Once we start to administer the anesthetic, the pain centers of the brain are blocked off, shut down, and whatever happens after that, the animal is typically in a significant plane of anesthesia, and what happens after that, they are unaware of, unconscious, and usually feeling no pain at all, often asleep. How long does it take for this process? This is also an excellent question. It is somewhat variable depending upon how old your pet is, how healthy they are. So we give an IV injection generally of the anesthetic, which requires your pet to have a healthy heart and good blood pressure and good vasculature to circulate this medication around the body. Sometimes when pets come in, their heart isn't working well, their blood pressure is very low, they're volume depleted or dehydrated, so there can be a little bit of a delay in the process. But in general, for most pets, it is within 1 to 2 minutes after the injection is administered. Most veterinarians these days like to give a pre-anesthetic injection prior to the euthanasia medication. And here's why. When we euthanize your pet, it would be, again, as I said earlier, similar to putting them under anesthesia for surgery. Now, in our conscious, we go through different planes of consciousness when we are being sedated. And what we are trying to avoid is having your pet stay in a state where they are semi-aware but not completely sedated. And sometimes when that happens for pets, they may seem a little bit upset, a little bit nervous. They may make some vocal sounds, and it seems like they're in pain or they're distressed, and really all it is that their body is somewhat fighting the anesthesia. So to combat that, we usually just give a little injection, a tincture of a pre-anesthetic. So propofol, which is something we use to administer anesthesia even for humans before they go through surgery. And it is painless, very smooth. Most people describe it as the best nap they've ever had. When you go in for your colonoscopy, this is the medication they use, and it is extremely predictable and very smooth and comforting, I will say. Your veterinarian will give the pre-anesthetic to kind of relax your pet. During this time, your pet will just start to feel sleepy, groggy, relaxed, and will usually still be awake and aware of you, which is great. That's what most owners want. Sometimes the pet is just so tired or dehydrated and just has been so sick for so long that when you give the pre-anesthetic, they go into a very deep plane of anesthesia, and that is okay as well. But the point is, this is not painful and it is a very fast process. The pre-anesthetic may take a few minutes to take effect on your pet, but the euthanasia solution, once administered IV, is fairly instant. 1 to 2 minutes. For some pets, it's 10 seconds. Now, your veterinarian will confirm death, cardiac death, by allowing the anesthetic to take effect for a moment or two and then listening with the stethoscope to your pet's chest to assure that there is no longer a heartbeat. And at that point, then we will pronounce them deceased and allow you to have your time privately with your pet to say goodbye before we take them away. So there is a word of caution here. Oftentimes, what we can experience with our pets, even after death, is that there might be 1 or 2 delayed agonal breaths, okay? These are like breaths that an animal or a human will take as they are dying and or even after death. And I know that seems counterintuitive, but you have to remember, even after the heart stops, there is still some electrical activity or impulses happening within the pet, in the muscles or in the brain, that takes a little bit of time to dissipate. And so we can occasionally see a twitch, a muscle jerk, a breath taken that seems like the animal is still intentionally breathing. There could even be a sound made as if air is passing through. This is something that people see commonly with humans as they pass. And then certainly as everything relaxes, you can get a release of the bowels and the bladder. And I just tell the owners to be prepared because, there can be a mess or something unexpected there. These are all things that have happened after your pet has already lost consciousness or may even already be deceased. There is no pain associated with it. There is no intentional actions that are happening, but it is something that we want to prepare owners for. And I will say that maybe 10% of the time these days, I see that with all the good medications that we have and all the different options that we have available. It's not something we see as much anymore, but there is the possibility. What options do I have as an owner as far as the choices that I want to make for the end of life moment and what happens after that with my pet? And that is really important and something that you want to think about in advance. And one thing is to think about the timing, which we're going to talk about that in just a moment, but that is a unique decision that really your caregiver can weigh in on, of course, but it is ultimately a decision for the owner, the family members to make, and no one else can make that decision for your pet other than you. Secondly, where do I want to have this done? And there are actually veterinarians that most of what they do is in-home euthanasia. It is just such a common occurrence. It's something that we do on the regular. There's a need for it, and a lot of people don't want to come into the hospital, or their pet can't walk and they can't transport them in. They're a 150-pound Mastiff. So it is definitely an option, and for many people it is such a comfort to stay at home, lay on their favorite sofa, and have a veterinarian or some other caregiver come in and administer these medications at home with the family there, and the pet stays in the living room the entire time. Now, even if you come into your veterinarian's office, which is probably the more common way that we have this done, you can still choose to be with your pet, and in fact, we encourage you to stay with your pet. I know that for some owners it's really hard, it's taxing, it's upsetting, there's some anxiety about that. I'm hoping that maybe this information will help with that. But also, your pet, until they become completely sedated, they are aware that you are there with them, and it's extremely comforting, and sometimes it helps them pass more peacefully. And I will tell you that if you're really uncomfortable and anxious about staying with them, another option would be to ask the veterinarian to give them a heavy sedative, and then you can step out once they are no longer cognizant, and your veterinarian can administer the final euthanasia agent that is another option. But staying with them until they are unconscious is what a lot of owners choose, and we definitely recommend that. And of course, we need to think about the remains of the pet. So this is something that a lot of people come in and they haven't thought about that, which makes sense. There's a lot of different choices actually that a lot of people haven't thought of, and so I like to prepare owners for this, whether you're doing an in-home euthanasia or you're having it done at your veterinary office. It's good to be prepared for these things and know what your specifics are in your area. So burying your pet at home is certainly an option, and a lot of people choose that. They want that. They may have other pets buried on their property. They may have trees in a certain special spot there. That is certainly a prerogative that we are respectful of, and it's a fine choice. You just need to be cognizant of, does your state have any legislation that says, you cannot bury your pet even on your private property? In general, most states will allow you to bury your pet on your private property as long as certain specifications are followed. There may be a certain depth that you have to reach before you can place your pet in the ground. They may have to be in a certain type of container so that none of the medications that have been administered to them can get into the groundwater. And these are all things to think about. But as I understand, there are some states or locations that have a ban on burying pets on property. So that's something to be aware of. Secondly, probably a very common situation that we have, especially in Tennessee, we have very rocky soil, and I feel like it's just becoming a hardship for a lot of people to bury their pet at home, is cremation. And with cremation, there are a couple of options there as well. There is communal cremation, where your pet is cremated, which I think we all understand what that means, but the communal means that the remains are not returned to you. So your pet goes through the process of cremation, but you don't wish to have the remains returned to you. Also, obviously there's a significant fee that goes along with that, and some people just don't want to have an urn sitting at home. Doesn't mean anything to them. None of these are right or wrong. Veterinarians, as professionals, we don't judge these things. I meet people all the time who say, oh, I have a collection of urns with my ashes at home, and other people say, I don't want that. I don't want a reminder of that. There's nothing for me there. And I think all of these things are valid. I want to affirm all of these decisions, but just to be aware, it's also an option for you to have your pet privately cremated, and then the ashes, the remains, are returned to you in a beautiful box, an urn, a memorial, some type of memorial thing, and you get those back privately, and you can do with those as you wish. That is what a lot of people choose to do. There is a cost for that, and it is done very tactfully, very respectfully, and it's something that we take a lot of pride in, because when our owners come and pick up their pets' remains, they're just very touched, and they feel a sense of relief, but also like they have something to remember them by, if that's what you choose.